Greetings to all PhysioTV viewers. As norm, we are going to get you another interesting talk today by an alumni of our own college, that is Sancheti Institute of Orthopaedics and Rehabilitation, College of Physiotherapy. We are presenting today a talk by Dr. Hay Patni. Dr. Hay is a DPT from University of Montana, USA. He is a master's in neurosciences, which is he did it from Sancheti College itself. He's also a director of H Physio, and he's also a HOD of Pediatric department at Singh Physiotherapy Clinic in Pune. He's an orthopedic manual therapist from UK. He's got a diploma in football medicine from FIFA. He's a chiropractic and osteopathic spinal manipulation techniques practitioner from UK, and he's a visiting faculty for the NCC Maharashtra. Dr. Hay, we welcome you today from the entire team of PhysioTV. He's going to give us a very interesting talk. And this interesting talk is going to be one of the premier series that we are kind of running this time, which is known as Young Clinicians Corner. This new series that we are starting is going to kind of have young clinicians present their perspective in clinical field out there. They are going to talk about their challenges, the solutions that they came out with, how practice is different today, and what is their take on for the future clinicians who are going to come into the field. So it's a very interesting take, and we would like to have young clinicians contribute to this series. And to start with, we have Dr. Hay today, and he'll be kind of taking it forward. And today's talk is going to be how to become a pediatric neurotherapist from a clinician's perspective. So over to you, Dr. Hay.
Yes, thank you. Thank you very much, Sona ma'am, for that lovely introduction. And thank you, PhysioTV, for having me here. And yes, so it's a very interesting story. I would not rather start it like a formal talk. I would just tell you about my journey, all right? So I was when we are in college, all right? When we are in college, when we are in lectures, we are very skeptical of pediatrics. I was the one. I used to fear kids. Okay. So that transition from fearing kids in my master's years to coming and becoming much and more comfortable and becoming an actual pediatric therapist, now having my own team under me, working under me for with pediatrics, it is a completely amazing experience. That transition, that growth, I wanted to share that. So the thing started off when I completed my masters, and so it was a very incidental way I shifted. So I was working at Dr. Singh's clinic. So we had a neuro department completely. So I was in the adult section. I would be managing the adult neuro section first, and the pediatric section was managed by other people as well. We have a fabulous team, by the way. So what happened was we started getting the patients from the Gulf, all right? So they have a very distinct language of Arabic, all right? And I was very fortunate that I had a little bit experience in it. So when starting off, I was taking shorter handovers because the language barrier was kind of a little bit depleted with me. So like the patients, the children were more comfortable with me speaking to them. And that's how it started. That's how I started transitioning to it. So before that, before I come to the point of what all I experienced, I would like to focus on one thing is uh, don't be scared of kids. Okay. It's fine. It's fine. All right. They cry. Okay. You have to have your ears very, very sensitized to that. Okay. They will cry. Okay. When you're starting out. All right. Sometimes people give up, when they
Yeah,
are
I
transitioning.
would say the other way around. I would say you have to be desensitized to the crime.
Yes,
Because
yes,
if
yes.
it's too, if you're too sensitive towards it, you kind of, get overwhelmed by it.
Yes, I
So,
know. It's both ways, all right. The word that I use, sensitize, I know it was not on the context, but it was deliberately put there because once you first you desensitize yourself, then you sensitize to understanding how they behave. Yes. So the cries are different. All right. All right. Now, after experiencing, I also know, yeah, she's hungry. The kid is hungry. The kid is knacking. All right. Yeah. So you get
just
that
like a mother,
experience. Yes,
just like
it's
a
like a
mother.
mother. So yes, so you have to, remove your man ears and put a woman ears here. So for me, it was the most difficult one, right? Me with a scraggy beard, coming up, handling kids, very different. But But when I see it now, when I see the transition, it doesn't matter. It doesn't matter. Kids don't judge you, so that's a good thing. Patients might, other patients might. Kids are good. Kids are good. I love. All right, they don't judge you. So first you have to remove that that fear, that anxiety. It's okay when you're transitioning first days, you are interested in pediatrics. There will be, you'll be falling, you'll be doing mistakes, but you will learn. That learning process throughout pediatrics is great, because the reward that you get, making a child walk, all right, and seeing the tears in the mother's eyes, that experience, that is what I strive for. That is what we as physiotherapists work for. All right, our patients are our gods. That is what Singh sir always tells me. All right, always reminds me. A patient हमेशा भगवान होता है, and I think Sona ma'am knows him as well. Yes, so I've learned from him here.
In
Because
fact,
of him. I
the entire Sancheti Institute now goes with the theme of, serving patients is serving God.
Yes,
So I
exactly,
guess
exactly. Yeah, it connects naturally. So yeah, so first the transition was very, very, very basic. So I was very familiar with the language. So yeah, the patients were more comfortable. Now for me as a guy, okay, I started to realize there are some things I have to change. All right, to approach kids in a different way. I can't make it how everyone does pediatrics. I had to learn a different way. All right, because most of the people say that we are living in a man's world. When I was transitioned into something that was on a woman's world. All right, being a guy around, there are obviously the babies are more comfortable with women, but I'm very surprised that God's grace, we have come to that practice. So transitioning, so I had a few points. So first of all, thing is handling patience. Okay, patience is the key. Okay, uh, why pediatric therapist is so much better than, it's not better, it's more interesting, because every time you uh, every time there is a dynamic shift in the age of the child. Okay, all right, so that causes the morphological and anatomical changes very fast. So you
true.
have very less time. Okay, when you compare it to neuro adult, all right, we have time. All right, we have time to improve. But here you're on the clock, all right? He's growing, his bones are growing. You can't let spasticity set into that range. You can't let that contracture happen. You have to prevent it. You have to make sure you prevent surgeries as much as possible. So that time frame, that knack of, you can say, you have to make split second decisions sometimes, regarding your treatment protocols of what this week will you be concentrating on, what the child requires. And it's fantastic because the anatomical knowledge of musculoskeletal therapy is so important when we are coming to pediatrics. I now know, ma'am, why you why you always push me. Yeah, musculoskeletal. I like it. So and now I know that importance. So because biomechanics are very different in children.
True.
The surface anatomy is very different. So that transitioning changes makes you learn the body in a different way. You have to break your nuances that you have developed from adult neuro. All right. Or you have to break, if you're a master's, if you're coming from a bachelor's background, I would advise all the young clinicians who want to practice pediatrics. You have to unlearn things to relearn something else. All right. Because that transitioning is important. So first I would advise, so my first thing is, for in my story, I believe that what the difficult part was to unlearn everything. All right, unlearn the basic concepts that I already had in my brain. If the muscle moves that way, no. And the kids, you have to understand, they are growing as well. They have different morphology. When you are treating a spastic kid, it's very different. When you are treating a dystonic kid, the biomechanics changes. And I was surprised, ma'am. I'm going to tell you, when I looked at it, of how complex it is. I loved it. I love complexities. I have learned to understand how everything becomes interesting. For me, okay, one thing about me, I would tell you before I continue, is that I like puzzles. All right, I like to solve things. So for me, neuro was the thing that, yes, it's a solution. Every patient, even if you see two MRIs
True.
together, the symptomatically they are completely different. All right, so that means a puzzle. You have to search exercises that are not in the books. That's not
Exactly.
given anywhere. All right. So that creativity that is there, that is important. So if you're looking at pediatrics as an option, as a career option, it's the best option. I'm telling you right now, it's the best option. All right. We are getting a lot of patients. Physiotherapy awareness is becoming
Mm,
more and more dominant now. Parents also know what their kid requires. They require a pediatric specialist right now,
mm.
not just a physiotherapist. Now we are
Exactly.
getting to hear those words. All
Exactly.
right. I'm very, very happy that now 3 4 years back I wasn't able to hear, but now it's very very good that physiotherapy is booming. So that transition is important to understand and unlearn things. Now the second thing is, yes, kids are very scared of white. Okay, white coats.
One minute. Just a minute. Can we take a
Yeah,
break? Dr.
yeah,
Shreyans,
no
can we
worries.
just check the Wi-Fi?
Yes, ma'am, I'll check.
No, did you get his what he spoke just now for a minute? Were you able to get it distortion free?
No, ma'am, it is breaking a bit.
It was breaking, right? Hey, this thing at your end is good. The
Yeah, my and yes, yes, my
the
Wi-Fi
Wi-Fi is
is
good.
yeah. It's on the
Okay,
server
so right
itself. Yeah,
now there's
yeah.
no problem, but which may just for a minute your voice was breaking.
Okay,
So
okay.
that's why I thought I'll just take a break and we can continue. Okay, so if you could just repeat just a
Yeah,
minute.
so I yes,
Yeah, start again. Yeah.
so yes, so I was speaking about the transitioning of your understanding of biomechanics. So one thing is, yes. So the second point is, yes, when you're coming in pediatrics, don't think you have time. All right, don't think you have time. That is
So
important.
when does all
That
this
is
learning take place here? Did
yes,
it
yes,
take place when
exactly.
you came into the clinical field after your masters, or did it happen during your masters when
It
you were
happened
doing your
during
masters?
I knew my faults during my masters. Okay, where I was
Okay.
going wrong, yes, I knew it was my masters, because the time during that we have a lot of other things to settle in, not to completely focus on pediatrics as well. But that transitioning phase, yes. So after I did my masters around a year or so, I was good in adult. I consider myself good in adult, that's my opinion. Okay. But so yes, so the transition happened. Actually the learning of the faults was through masters. All right, when I was masters, yes, I am very happy that Sancheti Neuro OPD taught me like hell. Like, even if you're a guy, you have to treat kids. So that was hammering of Sancheti that is now helped me out to understand pediatrics more better. So at that time, so yes, when I transitioned from yes, exactly, the learning, basically the approaches, the thinking of how I should approach this differently, that came when I was transitioned to actually a clinical practice in a pediatric therapy setup. So yes, so the second thing, so the next thing I would like to say is that I have seen for my, if you are a guy, I would say that you have to be very, very, very gentle. Okay, we have a rough touch. All right, neuro adult, we have rough touch. We focus on repetition, repetition, repetition. All right, yes, a lot of things to be unlearned. All right, there's a very vast difference between adult and neuro, very vast than we actually, and I actually thought when I was learning it. So that so when we are talking about how to approach it, one thing I noticed that I would advise the others as well to implement in their clinics to, abandon the white coat. All right. I believe that they are when kids are very skeptical. They remember bad days with white people. White coat people. They have cried this that. So first remove that element. All right. So I have kept a very good team, my whole team, when we are in a pediatric setup, we make sure we make colorful clothing. All right. So the children, all right, keep themselves oriented or towards themselves. So, okay, they know, okay, they are at a safe place. All right. First, that transition helped me a lot. Once I started changing my attire, I saw changes in the kids' reaction. Well, yeah, now we can do this. All right. So that transition was very important. And I believe that is a very important thing. We should implement it more. And then thing is, mothers talk to their mothers. All right. For males, if you're a guy, looking for pediatrics as an option, there are some people who are very focused. They know that what they want to do ahead. All right. If you're focused in it, and if you're a guy, or if you're transitioning, thinking in pediatrics as an option, one thing is communication, especially with mothers. All right. You know, uh, I know there are some language barriers that comes, all right, some communication barriers that come. But I I was so anxious when talking to people first, to talking to parents first, all right. Uh, but I will tell you the reality. It's not like that. It's not like that. When you actually see, I've seen mothers comfortable speaking to me as well. All right, they were more speaking because they tend to realize that okay, we can talk on a third perspective like that. All right, so once is communication. Don't be afraid of communicating. All right, make the patient comfortable. Even if you are not there, make in pediatrics all the female therapists as well. If you are going through that perspective, communicate with their mothers, all right. The child is only in your hands for an hour or two, all right. Rest of the day it's in mother's hand. Believe the mother, trust the mother. She sometimes knows better than you, all right. If you are a pediatric therapist, don't let that get into your head, all right. Sometimes that happens. You should not let that get into head, all right. We have to reevaluate. If the mother thinks the child is crying, all right, that is concerning for her. There's some other issue, might be because of the previous therapy, more stretch, less stretch. Reconsider it, reevaluate. Do not ignore the mother. That is, I think, the main crux of thing. And when you start to listen now, I think when you start to listen the complaints and the behaviors of the child, all right, I would acquire that. Take your time during history, all right. Sometimes in pediatric evaluation we just see, okay, what happened during the NICU visit, but handing the no, all right, or what all milestones we see. No, I think you should understand, ask the mother, has the behavior changed throughout, all right. How is the child now, how does he behave, all right. That we are more now into coming into the sensory integration, as you might have seen. It's a new thing, very good concept as well, all right. So in that we are taught as well to understand the behaviors of a child, but we are just ticking an evaluated box. Rather than that, I would suggest include that evaluation, that behavioral evaluation in your assessment history, all right. Make it a part of your history, all right. That has helped me a lot, all right. I used to scribble down notes in our case reports, and everyone used to say, what are you writing? Oh no, I have to write this. This helped me transition. So when you have, the child is cranky, when he is wobbling, mother says कि जब भी कोई कुछ चीज हिलती रहती है या फिर when they unbalanced teeth, the child is wobbling. That sense of information will help you in your therapeutic intervention, all right. When you're taking the child on a bolster, when you're taking the child on a Busa ball, all right. That things, those things are very important to understand. So 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 you have to be very, very, receptive as a therapist, all right. If you aren't a receptive therapist, if you believe, then I believe that you have to change that habit. That when pediatric, that habit comes, all right. And I am telling you, not from someone who's been receptive. I wasn't receptive. I was very, when I was in adult neuro, sometimes, adult neuro patients are stubborn, all right, very strict, all right. So that you have to unlearn, as I said before, you have to unlearn things before you learn them. So that stubbornness that you had, no, we make patient exercise more. We make patient exercise more. Pediatric is different. Don't do that with kids, right? You have to be gentle. You have to understand kids. And the beauty of pediatrics is, I think, before I had a different perspective regarding, okay, he, there's a concept that is stable. It was static when I approached pediatrics in my earlier years. It was static, but I know it is now evolving. All right, your therapy should evolve, and sometimes, people believe that manual therapy as of such, is not helpful, all right, is not much used. I don't know where that has come from, but manual therapy is such an important concept with pediatrics. You have to understand that. And yes, my doctorate in PPT, did my capstone in manual therapy. So that information as well, transitioning to this, has exponentially, improved my my therapy, my therapeutic interventions as well. And I believe that is why, by God's grace, we have a good run with our pediatric department. And one thing is, and third thing is, yes, pediatric, when you're considering, it's not a single man's job. All right. So yes, understand that. All right. Yes, some might not agree with me. It's fine. Oh, it's fine. It's I'm not saying that it can't be done alone. It can be done alone, but understand it's not a single guy's job. You have to have a partner. You have to have someone to work with, because most of the exercise, when you want, you need a distractor. All right, the one who distracts the child and one who does the intervention. All right, you need that distractor more. Sometimes you see the one who does the intervention is important. No, 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 no. The distractor, the secondary therapist who is there with you has a more difficult job. All right, it looks nuances like he's playing, but no, you have to understand. All right, dynamic movement changes throughout the kinetic chain in a child to create that transition. The front one wants to know where the reach out is to be given. It is not just giving reach out, it's the place where it should be given, so that the dynamic kinetic chain connects and you activate and recruit those muscles exactly. So I think this statement is the one that that made me understand that okay, we have to have a partner here. All right. So teamwork. All right. You can't be a
In fact,
pediatric
I
therapist.
think that's what it is. There's a whole team involved. I think
Yes,
even
there's
the
a whole
mother
team.
or the parent is a part of the team.
Exactly.
All
I,
right.
I'll be I'll be
Yeah.
coming to
So
that as well. Yes,
in
yes, yes.
fact, even I guess occupational therapy, maybe a
Yes,
speech therapy.
yes,
So all
yes.
these also are very important, I think, integral part of a team,
Exactly.
which,
Exactly.
betters the outcome of a child.
Exactly. And one thing I would say about Sancheti is when Sancheti practices, they have a very good relation between the orthotic department and the pediatric department. All right, and it is very necessary to understand the orthotic needs of the child. You have to communicate that. All right. I myself send my patients to Sancheti for orthotics because I have a very good relationship with them as well. And they are very, very kind and very supportive every time I've contacted them regarding some of my patients and clients. So yes, I'll be coming to that as well, because the team building that you call, Mouse, it is exactly correct. You cannot work alone. You have to have a team. All right. And it is not just considered of your therapist, it's parents' involvement as well. Again, tell you the same. The child is with you for only hours. All right. Throughout the day is with his mother. I see. I don't know. This is my opinion about it. Uh, sometimes I see in departments that I worked with before as well, or sometimes that hearing from other therapists that when they are treating the child, the mother is not uh, it's my opinion, but I feel that you should involve her, at least teach her a lot of things and let her see what you're doing to the child. All right. And regarding the secondary therapist, all right, sometimes if you're working alone, okay, sometimes there are independent clinicians, after their bachelor's and master's in pediatrics, they want to start on solo setup. So if you're starting out, I would say involve the mother as your secondary therapist. All right, teach her where to go. All right, I think that changed my whole perspective completely. My whole practice basically changed on one of my turning point was that when I started bringing the mother to play with the child, and I was like the shadow. All right, just doing the manipulations or the adjustments to be done. All right, the positions to be held to put the knees or the spastic muscles in a certain position to recruit and activate them. All right, so if you are a starting out therapist, right, you're thinking of a smaller pediatric setup, involve the mother as a secondary therapist. You don't want to hire an no problem, नहीं है कोई problem. मम्मी को बिठाओ, मम्मी को करने दो exercise. वो मनाएगी. She will make the kid shine. She knows the kid. Believe in her. That is the all right. So that completely transitioned my. And after that, we had a concept. Older therapist has a concept कि मम्मी को नहीं लेके आना. That child cries inside. All right. Okay, it will cry first 2 days, 3 days. All right. But once let the child get comfortable with you being in the mother. All right. What happens when you don't involve the mother? This is my understanding of it. The child thinks that you are a threat. Whenever you come, mother is gone. So he will always cry with you, obviously. All right, all right. Even if you take this logic inside your own clinical practice, inside your own life, if someone takes the loved one out of your life, obviously you will hit them. So that's why understand these things. These nuances are important. The child doesn't hate you. There are reasons why he's crying. So I think that is a very good point to note, okay, because I believe that is my opinion. Many pediatric therapists might, that is what I have seen that has helped in my practice. So that is amazing. So next I would talk about, yes, the team. The team, when you're talking about team, I'm talking about speech therapists, all right, more and OTs. Okay. Orthotics, yes, orthotic department, you can contact them, you can tell them, you can resize them, you can retest them. So you have a communication. Normally, physios have a lot of communication with orthotics, but OTs, finding good OTs, oh my God, has been hell for me. I'm telling you, ma'am, good OTs should come up. We need OTs in pediatrics. We need OTs. We need good OTs, and don't think of OTs. No, they do. If you get a good OT, I've seen changes in dramatic changes in children, dramatic improvements in children. You need a good OT with you. You cannot neglect that part. I'm telling you, I'm telling you from my mistakes. Learn from my mistakes. All right. I've done mistakes, a lot of them. That's how people grow. All right, humans to earth. So it's fine. But understand the importance of an OT. Keep a communication with your OT. What is the OT doing? Is he doing sensory practice today? Is he doing
Mm,
convocation training? You have to understand their syllabus as well. All right. So
mm.
that opens up a complete different understanding of pediatrics.
True.
And I would advise that yes, clinics should start understanding, have an OT contact there. Whenever
Yes.
you have someone, okay, if you are a physiotherapy pediatric clinic, you have to make sure that you have a good OT or at least an OT
Exactly.
contact. It is
Exactly.
necessary. Okay, that is very, very, very important. Okay, next coming to speech therapists. Okay, a very, very good concept. Okay, speech. It's the most difficult aspects, I believe. If the child speaks, it's very easy. Things get a lot easier. Lot easier. I tell you, ma'am, it is a very, very easier when you can communicate with the child.
Exactly.
But when you can't, oh my God,
Yeah.
you have to understand things. And as physiotherapists, yes, we are trained to treat children without their voices.
Mm,
I don't like that. I personally say I don't like that. Have a speech therapist as a friend or contact them. Okay, if the patients are not that much financially good to take that speech therapy as well as physiotherapy, contact a speech therapist. Learn to understand how you can do some of the maneuvers to improve the speech at least. And when I'm talking about speech, it is not just the orofacial muscles musculature, it's about communication. you know
mm,
Speech therapists teach you, go to them, learn how to communicate without the speech as well. All right, teach the child. Okay, if sometimes we get syndromic babies as well, fragile syndromic babies as well. All right, sometimes they that means they grow ahead, and after they are born normally. All right, and as they grow, they start having deformities and deficiencies as well. So
mm.
with those, they can communicate, but you have to find a way throughout it. That one channel is first. If I would say, if you're starting out, that one channel is the first. Parents, ask the parents how they communicate with the child, and then replicate it. Or else, take an advice from a speech therapist and learn about it. I'm not saying that no, just hear and do stuff. Learn about it. Go to them, learn about it, see how they practice. I believe every pediatric therapist, or every, if you're learning, I think colleges should start that. They should take their neuro masters to speech
Mm,
therapists and
mm.
sit down and see how speech therapist is done. Similar with the OT, how OT is done, because we have rarely seen in our lives, right?
Exactly.
Yes, exactly. That is important. That aspect is important. So when you're treating pediatrics, it's not just the surgeons,
Mm,
not just the surgeons, the neurophysician that you have
mm.
to keep your contact in. I know they are the reference materials. They are the referencing people to you. They are the money givers. But keep those things in handy, because once you start treating the child in a multidisciplinary way, you
Mm,
will see exponential improvement. All right, we find pediatric therapists complaining improvement is slow. That no, it takes time, contractures develop. No, there is something lacking in the therapist.
mm.
You have to understand that no, grow improvement can be done. There is something other than what you're doing. If you're doing the same thing again and again and getting the same result and that you don't want, you have to change stuff. You have to be, so that is what I'm saying. You have to unlearn that stubbornness, you have to give up, all right, to make that transition. So that is very important, I believe, regarding the team, that consider, take your speech therapy seriously, take your OT seriously. I have continuous contact, good contacts with my OTs and speech therapists, all right, who we refer to, and they are, and they communicate. It's not like the OTs or PTs का कुछ ऐसा कुछ भी नहीं है, ठीक है? They are all good. Once you have to just approach them, they will help you out. And the last, I would be concluding now. So the last thing I would be taking away is, you know, don't be harsh on kids. Right? Don't be harsh on them. I am a very, like, I was a guy like that, that when a child cries, all right, you have to be, no, don't be harsh on them. All right, understand what they are going through, understand the pain they are going through. All right, and especially when this child is unable to speak, yes, understand that the crying is the only thing, is how he communicates. All right, his way of communication is crying. So you don't have to
Exactly.
misunderstand that, not misinterpret it. Have patience, go ahead. If you are looking for pediatrics, go ahead. We need pediatric therapists, I'm telling you. We, after I started we started growing our pediatric team more and more into a bigger, we have, I'm very happy now that we have around 3 4 therapists with us that are very good, all right, and people are coming to learn as well, according to that, from different things. So that is, I think, that is very amazing. So don't be afraid of pediatrics. You have to just see it in a different perspective. Thoda sa, get out of it, get out of the box and see it as a third person. Okay, it's not a one to one interaction. पहले देखो, पहले बच्चे को देखो, समझो, अरे वो आया है आपके पास, ठीक है, their mother has come with hope, all right, put effort, put effort. We have to take pediatrics a little more. Eh? All patients are important, but pediatrics a little bit more serious. All right, and I think I know it's I think it's this transition. It's not by me. It's by the divine intervention. I believe in divine intervention. All right, मुझे ये करना ही था. कैसे ना कैसे करना यही करना था. I have become a therapist to treat your kid. you know, yes, my
Good.
whole life journey is to this. So I believe in that concept. So yeah, so my takeaway is, okay, just don't be harsh on kids, all right. And take your time. Take your time. No, you'll learn.
So,
You'll learn. Don't worry. You'll learn.
great,
All right.
great. So, Dr. Hay, it's been an absolute pleasure to listening to you. In
Thank you.
fact, there have been so many clinical pearls. I guess premiering this series as like Young Clinicians Corner, I think even many of the therapists who are practicing since years can get some clinical gems about
I hope.
how they.
I'm
In fact, it'll also give them an idea about when young therapists come to them. What unlearning is needed and what learning is needed.
yes.
So I guess it's been an absolute pleasure. In fact, you've given a lot of pointers. I kind of actually jotted it down. And first and foremost, of course, is your this thing about takeaway that don't be harsh on the child. And communication is the key, even with the parent, even with the
Yes.
child.
Yes.
Behavioral assessment is something that adds value to your usual assessment because it's an important aspect. So that's even for adult patients, and I guess for pediatrics also it goes a long
Yes.
way.
Yes.
And
Yes.
as the child is growing, as you
Yes.
said, the time is short. That is very important. Time is very important, and getting the changes, because what happens is if we have the same impairments, the disability
Exactly.
keeps multiplying
Exactly.
because the
Exactly.
motor demands of the child keeps
Exactly.
increasing the day.
Exactly. Exactly.
This is
Correct.
something that
Correct.
I have also kind of learned. I've stayed away from pediatrics. I'm one of those people who kind of
Yes,
get very
I know.
apprehensive
Yes.
with pediatric patients. But I
Yes.
guess you've given a very fresh take on
Yes.
what
Yes.
has been your journey. In
Yes.
fact, we would like to call this talk the nuances of becoming a pediatric therapist and
Therapist.
a young
Yes.
clinician's perspective.
Yes.
And about the time is short, listen to the mother, desensitize and then sensitize to the cry of
Yes.
the child. Get
Exactly.
a
Exactly.
woman's ear, that's a
Yes.
mother's ear, I would say, rather than a
Yes.
woman's ear.
Yes.
Get a
Yes.
mother's ear to
Yeah.
kind
Yes.
of know
Mother's Day.
what the child
Yes.
is crying for.
Yes.
And
Yes.
the dynamic nature, the dynamism of the therapy, which has to
Yeah.
keep changing, keep molding, keep improvising every time the child is
Exactly.
posing with new challenges, new turns in
Exactly.
your
Exactly.
therapy. You have
Exactly.
to keep improvising. And about manual therapy, so I myself I
Yes,
experienced here as a
ma'am.
manual therapist, and I should
Yes.
say he's got a great
Thank
hands to
you,
become
ma'am.
a manual
Thank,
therapist also,
thank
and
you, ma'am.
using it
Thank you.
in benefit of the children has, I'm sure, is going a long way, because they too have musculoskeletal issues
Yes.
which
Yes.
need joint
Exactly.
or soft tissue,
Exactly. Exactly.
techniques
Exactly.
which
Yes.
should be
Yes. Yes.
handled,
Yes. Yes.
because as a
Exactly.
growing child, growing bones, muscles with increased tone, you need
Exactly.
to kind of tackle
Yes.
different musculoskeletal
Good.
issues also.
Exactly. Exactly.
And
By
the
the way, I would.
teamwork. I
Yeah.
have
Yeah.
been a big believer of teamwork. I always
Yes.
believe that
Yes.
it's always a team which
Yes.
gets a patient better. It's
Yes.
never
Yes.
one person's job, and it
Exactly.
shouldn't be.
Exactly.
It shouldn't be.
Exactly.
If
It
you
shouldn't
think
be.
you're the whole and soul, you are kind of
It's done.
robbing
It's
the
done. It's
patient
done. Yes.
of what he could have achieved with the teamwork. So
Yes.
I
Yes.
very much believe in what you said. So
Yeah.
yeah, so a lot of gems of wisdom, and I'm very very glad that we started this and got this
Thank you
very
so much,
fresh.
ma'am.
In fact, Dr. Hey, I would kind of request you that you should be coming to PhysioTV again, and
Sure. Sure.
telling us about the second therapist ka role. How the
Yeah.
distractor or the therapist who is kind of in the background, or the mother
Yes.
or the
Yes.
parent himself
Yes. Yes.
can
Yes.
act. So you can give us actual demos, or give us
Yeah. Sure.
examples about
Sure.
how,
Sure.
so we
Sure.
can have a talk
Yes.
with the this
Yes.
thing.
Yes. Sure.
I'm sure it will go a long way
Yes.
in
Yes. Sure. Sure.
even younger clinicians who are coming into the
Yes.
field, soon passing out and entering
Yes.
this foray.
Yes. Yes.
Will surely be guided with all
Yes.
these
Yes. Yes.
techniques, you
Yes.
know
Yes. Surely, ma'am. Sure, ma'am.
so
Always,
yeah,
Sancheti is my family. All right.
thank you so much.
Ma'am, I've always considered to Sancheti. It's like you've been there at my hardest times during college as well. So yeah. So
Thank you
definitely,
so much.
definitely. I'm very glad that I've continued my association with Sancheti throughout. So I'm
So
very happy about
So
it.
from
Yeah.
the
Thank
entire
you, sir.
team of PhysioTV, which is
Yes.
also a unit of OrthoTV, and from the entire Sancheti family, I would say,
Yes.
and from the team of PhysioTV, I would really like to thank Dr. Hay. And I'm sure if y'all are a young clinician out there and y'all want to talk about your perspective, do get in touch with PhysioTV, and we should be able to kind of, reach out your voice to these other younger clinicians who are coming into our field. So it's a signing off now, and we are very, very glad that we could have Dr. Hay to start with our Young Clinicians Corner. So yeah, so great success. God bless. I'm sure
Thank you,
there's
ma'am.
a lot of divine intervention and
Thank you, ma'am.
some supreme forces of nature which have
Alhamdulillah.
kind of put you into
Alhamdulillah.
this field.
Alhamdulillah.
Yeah,
Yes.
and
Thank
this is benefiting the children for sure.
Yes, yes,
Yeah.
yes,
So thank you
yes.
so much for
Okay.
being
Thank,
with us.
thank you
Thanks,
so
thanks,
much,
thanks.
ma'am. Thank you, Physio TV, for having me here. And I am very, very blessed to have, a communication channel like Physio TV as well. I've been taking lectures before as well regarding, I think
Yes, yes, yes,
you've
I
done before
remember.
as well. So yeah. So
So
yes.
please like and subscribe. You can spread the word also, and please like and subscribe the Physio TV also. You will get the recent the click. I mean, if you click on the subscribe button, you will get to know the recent videos that we are uploading, and you'll kind of come to know all such gems of talks which we are kind of holding with many people, and we have got many sections and many series going on. So do join us, and thanks again.
Yes,
Bye
thank
for
you so
now.
much, ma'am, for having me. Bye.